So I'm here with Lola, and what we're going to do is we're going to go through some different correctives that we can do to work on her ankle mobility. Now, when we go through these, we're going to do 3 different examples, but all 3 are going to be without equipment. Lola's a basketball player, so when she's on the road or when she played a pickup game outside, she's not going to have any equipment, and I don't want her to have to rely on it except for a towel roll, which she could easily throw in her bag. So the first one that we're going to do, Lola, you're going to be kneeling with one knee down, and let's put the ankle up that's bothering you. So she has an asymmetry side to side, so we're going to focus on the ankle that's been bothering her. So she's going to start nice and tall. Her ankle is up on this, her heel's on the ground, and her toes up on that towel roll. That's going to start her into a little bit of that dorsiflexion. She's going to reach up nice and tall, and then she's just going to come forward and try to touch the mat out in front of you. Good. And then come on back up and reach nice and tall. As she's coming forward, I'm watching to see and make sure that her knee stays over the outside toes. We want her to use her dorsiflexion. We don't want her to compensate by going into some knee valgus or by dumping her arch in order to get there. So as you go down, you're just going to focus towards your outside toes and then come forward. Well, where do you feel that when you come forward?
I feel like in the back.
Good. Yeah, we want her to feel a stretch, or we want her to feel it in the back of her ankle. So go ahead and do a few more reps of that. Good. And she'll pay attention to how far forward she's able to get, how far she's able to reach out. What she could do also is she could start on her side that doesn't feel so restricted, see how far she can get, switch over to the one that's been somewhat restricted, and see if she can get to the point where she matches that. Okay, so the next exercise that we're going to do, we're going to have you start almost in that kneeling position you were before, but keep that right ankle back. Let's go back with that ankle. Good. And then both hands are going to be on the front of that foot. You're going to bring your toes in that back foot, and then you're going to push down into the floor. Good. And now come up and try to drive this heel back. Good. And then come on back down. Now Lola can play around with where her knee is. Sometimes if she brings her knee a little bit farther forward or a little bit farther back, she's able to get into more of a stretch. But her goal is to drive that back heel down. Good job. Lola, go ahead and face that way just so that you can get a different angle. And then both hands on. Now when she pushes down into the floor here, that's actually going to help make her core go on, which will make this movement a little bit easier for her. And she's just going to go through a few reps of that until she feels like she's starting to get some more motion. Again, doing it on both sides. If she starts on the side that doesn't feel restricted, then she gets a good appreciation for what she can expect once things start to loosen up. For the last one, we're going to get Lola into now a more standing position, and she's going to put her, we're going to grab that towel roll again. You're going to put your right toes up on the roll, and then you're going to step across so that your left heel is up. Good. First, let the person just kind of get their balance. It's going to change your center of gravity a little bit, so just feel that out. You're going to reach up towards the ceiling first, stay nice and close into your body, and then reach towards that back foot. Good. And then come on back up. So now not only are we getting through some of that motion in the ankle and also in that posterior chain, but it's also challenging her in a standing position now and also challenging her balance as we go. Now it's equally as important, while she reaches down, that's where she's going to feel the stretch, but when she comes back up, she reaches towards the ceiling. That helps her figure out where that pelvis is in space and doesn't let her cheat as much through the motion. The other thing I want to watch as she's doing it, and she's doing a good job, is that she's not hyperextending that back leg. I want her to use the dorsiflexion range of motion and not try to compensate by hyperextending her knee. So what do you do if, when you're doing these exercises with a client, a player, or a patient, they feel them more in the front of the ankle than they do behind the ankle? Well, we want them to feel it more behind the ankle because then we're getting into that soft tissue, we're getting a stretch. If they're feeling it like a pinch in the front of the ankle, we don't want to just keep doing those exercises because sometimes that can aggravate things. So one thing that you can try with your player is to have them do almost like a self-mobilization. So go ahead and bring that ankle forward again, Lola. What she's going to do is she's going to use the heel of her hands on her ankle bones. And she's going to put it right on the lateral and the medial malleolus, and she's going to be pulling backward And as she pulls backwards, she's gonna come forward. Good. Where do you feel that when you do it?
Just the back here.
Yeah, in the back. A lot of times that can just give some input into that joint where the person's then able to stretch into it and get more of the sensation in the back versus that pinch in the front. If all these exercises though keep causing that pinch in the front, then that's when you might want to get that ankle looked at and see if anything else is going on.